Hello everyone. Please do just wave your hand if you can't hear us, because we're not used to standing at the microphone. Okay, so we'll dive straight into what our research is about, and Karen has done such a good job of introducing us that we won't talk any more about ourselves, but we did just want to point out that this was very much a team effort, and we had really great support from a research officer at our university, Jen Rawson, so a big thank you to her. And also thank you so much to MMI and the RCVS, because we were the recipients of the Sarah Brown Research Grant in 2023, and Jackie and I were just chatting in the break that never before have we worked with such a compassionate and supportive funder, and a funder that has so deeply valued the findings of our research and gone way above and beyond to map the recommendations of our work to their ongoing and future work. So thank you so much for all the support you've given us, and we hope that this is just the start of a very long journey in our research agenda with you. So when we first embarked on trying to understand the veterinary context, as you know, our backgrounds are in sport, but we have common interests in mental health and well-being, and that brought us to find the call for the grant where we had common interests. And when we were having a look at the research in veterinary science, we were quite blown away by the data and the disproportionate rates of suicide and mental ill health that's reported in the profession, which is why we became really passionate about working in this space. We also know that one way in which to prevent mental ill health and to support mental health is by upstream change, which Lizzie quite nicely pointed out this morning. So we're talking about prevention here, not about cure. And we realized that actually integrating better mental health principles and practices into student veterinary nurses' education was one way in which we might be able to get in early with members of the profession, particularly nurses, in order to try and improve their prospects in the career. And naturally that leads to all sorts of positive outcomes like better retention, less mental ill health, etc. We know also that psychologically safe learning environments are one way in which we can support mental health, and Jackie's done some great work in this area, albeit in slightly different contexts, but all about reforming curricula to try and support better students before they enter the profession. So the aims of our work were twofold, really. We wanted to scope out what was already there, so we wanted to understand better the veterinary nursing education landscape, and really importantly, to develop and execute a program of progressive work that led to a set of evidence-based recommendations to improve mental health in this particular context. So we first executed a scoping review, then we did a set of interviews with quite a broad demographic group. So I'll talk to you briefly about the scoping review first. What we wanted to do here was review publicly available information to understand how veterinary students are being taught about mental health, what principles are included in veterinary nursing education to try and boost the mental health of the future generation. So we did that via desk-based work, so scoping review of both further and higher education institutions. And what we found was some really great examples of good practice. So some courses that were quite clearly very well attuned to developing students and supporting their mental health. But what we also found was that the integration of mental health principles was really inconsistent. So some places were doing it really well, other places not so much. This isn't a criticism, it's just what we found. We also found that most, if not all, institutions were carefully considering the RCVS standards that relate to student mental health. But the extent to which these were explicitly addressed in the curricula was often really not clear. So that led us to use these findings of this desk-based work to then do some interviews. And it's important to point out here that we spoke to a lot of people. So we spoke to veterinary nurse tutors, veterinary nurse students, and qualified veterinary nurses. And we had roughly 10 people in each of those groups that we spoke to. And what we wanted to find out from them was, what is it that's actually being done currently to support students' mental health, and what might we do differently? So it was very much a co-produced set of recommendations where we were asking people, what do they think is needed? What is the future of mental health in veterinary nurse education? So we had 27 participants in total, and we felt like this was a really unique opportunity to speak to different people with different perspectives. And for those of you that are interested in research methods, of which I particularly am, so if you do want to talk more about methods, please come and find me in the break. We used abductive, so that's a combination of deductive and inductive analysis with all of the data, and triangulated our findings across the 3 participant groups.
Hey, so I'm just going to talk to you about the research finding. As Faye said, we had 3 groups of participants and then we triangulated findings. So quite a lot of work went into pooling these findings together. And what we found was 6 different key themes with lots of different sub-themes. We obviously don't have time to go into depth with all of them. So what we're going to do is to briefly describe what these are, then just go in depth into a couple of these findings, which then resulted in some recommendations. So the first box on there is taught content that contributes to students' mental health. So that is all around what is going into the curricula, what enhances mental health. So yes, this might be a bit about teaching about what mental health is, what mental ill health is, but it's also about including principles that enhance students' mental health, enhances their confidence in their skills, but not just their skills, their veterinary skills, in terms of their academic skills, and also in terms of developing their skills of advocacy, advocating for themselves, and being able to speak up at times, either at their institution or in the workplace. Then we also found some interesting comments and discussions around curricula, around assessment and how, if mental health is assessed, how it's assessed and what that looks like. And there was mixed practice out there on that. The academic environment itself, so what's it like to study at either the university or the college? Is that a supportive environment? Does that enable people to thrive within that? That gives them the skills to then go out into the workforce. Looking at the provision, what's at universities and colleges, and of course that differs. Every university or college has some mental health support, but we looked a bit closer at what that is and if students were aware of it. Of course, the placement is a big factor for students, so looking at that experience, but also the experience, how that links in with the university, and I will talk further into that in the next couple of slides. And also the culture of the clinical practice had a big impact upon that student experience as well. Okay, so the 2 I'm going to talk a bit more about, that academic environment and also the placement environment. So what we found with the academic environment was around actually how students are taught. So actually developing relationships was really important. And of course, some of these findings are what we found was beneficial, and we know that actually practically, these aren't always feasible. But what we did find that actually the amount of contact time with students, with tutors, was really important. So the more contact time, the better. And also with that, having smaller group sessions and smaller groups where you can really develop those relationships with either your tutor but also your peers, because that is obviously the foundation of that support network when they do go out into placements as well. What we also found was having flexible learning opportunities or flexible assessment, but also actually flexible timetabling, which sort of in a way contradicts a bit of the in-person, because some people will say to us, actually having the flexibility to have some sessions online or to not have to come onto campus all the time is actually really helpful, because of course there's life outside of university and college as well, with some students working on top or having caring responsibilities on top. So actually having that flexibility was really important, which I say is a bit of a contradiction to actually, but actually in-person time was also really important. We also mentioned already this morning the neurodivergence, and we did find, and there was a lot of discussion through from the students to the tutors to also the veterinary nurses themselves, talking about the impact of neurodivergence and how we can best support students either at the placement but also within academia itself. And this was around what support was available, if they knew what support was available, but also around actually matching and mapping student needs onto their placement and where they're going as well. Okay, we have got a lot of quotes. This is a small handful, and what we're not expecting you to do is to read all those quotes, but I think it is just worth pointing out a couple of things on here. So, for instance, you can see throughout people talking about ADHD, people talking about neurodivergence. There's also a quote on there about induction and how you go about inducting students, where people and students are saying a lot of the time we are told about wellbeing services, but that might be in the induction in the first week, and then we forget that information. It's not really revisited. But others saying that we're given a lot of information, absolutely nowhere to go. So there's very much mixed practice out there as well. But say academic environment isn't just about the support available, it's actually what goes into that curricula and how it's taught, developing skills for students to go out into that world feeling that they are able, that they are competent, that they have the skills to thrive when they go into the workplace. Okay, so the placement environment, as I say, this unsurprising was a big topic and talked about a lot. From all perspectives, from the tutor, from the vet nurses. The vet nurses who we interviewed, a lot of them did have clinical supervisor roles, or had roles within mental health, within their workforce, but they all had links with the students that were coming in. The culture of the clinic or the practice that they were in had a big impact upon the person, and we were getting a lot of information around culture, and what we kept saying the role and the research we're doing, we can't impact culture when we're looking at curricular design, but obviously that is something that has an impact upon the student. So what we could look at potentially is actually how do students develop the skills whilst at college, whilst at university, so that they can advocate for themselves and for others when they might see things that aren't right, or even things around their own well-being, in terms of being able to. Sometimes it's things like, not having a lunch break, but not necessarily feeling that they had the confidence to talk about that. So being able to talk to that as well. There was discussions around, mapping students and students going in with the information about themselves that placements need. So some colleges and universities are amazing at giving the colleges and having a communication, having connection to the practice themselves. Not all do, and we definitely saw that mixed practice. And clinical supervisors are telling us where we have that communication, that constant communication with the university or the college, that's brilliant, because then we know exactly who to go to if something does happen, or if there is a stressful situation. Okay, I'm going to just go to move on to the recommendations. Again, got quite a lot of quotes through from the placement environment. Again, not expecting people to go through that, but just to highlight some of the information and the depth of information that we did get from these interviews that we conducted. But yeah, I just want to move on to the recommendations before our time is up. And again, we've just picked out some of the key recommendations that we thought were useful for today. So we absolutely had some recommendations around the taught curricular content. So this included things such as making sure that mental health is integrated into the learning outcomes of the course. Where you can have small groups, we know that's not always pragmatic. Also, what came through quite loud and clear was that veterinary tutors and veterinary nurses want more education. They want more training themselves. They say, it's all right if we're talking more about mental health, but I don't know how to deal with that. So actually, tutors were saying, actually, can we have more training, please? And also, it's to include more actually assessment of mental health. As I say, that's not just always around mental ill health, but actually how we're enhancing mental health as well. Because if it's assessed and it's in the learning outcomes, then we know that that will be something that is ensured that it's within the curricula. Okay, I'm going to finish there. I think it's time for questions. So thank you very much.
Has got any questions, then can you please raise your hand and somebody will come to you with a mic.
Hi, are you published yet? Where can we read?
Sorry, was publishing?
Yeah, can we read this?
Yes, you can. And these guys have some of our publications. I don't know how we can share that, but the information is with MMI, and we are currently writing a paper that will be published out there as well.
Thank you.
We're not far off. We're not far off.
Sorry, getting very close. Just to follow up on that, I think Jackie made the point quite clearly anyway, but this has been, such a huge investment over the last couple of years, and there is so much richness in the data, and it's really varied, really broad. So we did produce a report in the form of a slide deck, because Sam is so wonderful that he doesn't want us to spend loads of time writing a report that no one's ever going to read. So we do have a slide deck. I don't know, Sam, might it be possible to share that? Give me a nod or a wave if it is. Yeah, it might be possible to share that. So you can always drop us an email. But when the publication's out, we'll be sure to send that on to whoever is interested. Be nice if someone actually reads it.
Just a question about your scoping review. Is anybody taking a public health approach to curriculum design specifically in this sector?
Not that we found, no.
And do you know why that might be?
No. Can we chat in the break?